Well, hello again. This is Tom Lenz, and we're going to start into Module 1 today. And I've got a few slides to cover that are just going to give a little overview of what you're going to be reading about or what you have read about for this module, and give a little context of what we're talking about. And this will be consistent from one module to the next. So I'll put together a few slides so you can at least get my take on it as you go through the readings for yourself. So today we're going to talk about the US healthcare system, US healthcare in general, the Affordable Care Act, how we compare to other nations that are like us, and that will kind of cover this section of the module. And the reason that I thought it would be a good idea to start with this is it gives us a good idea of the context of where we're coming from. Okay, we all probably know, since you're in the course, that lifestyle medicine is important. Healthy lifestyle behaviors are important. It's difficult to argue that. Most people know that, even for those people who don't have the best lifestyle, most people know that a healthy lifestyle is important. So that is aside from what we really want to talk about today. And knowing that information, it's good to kind of get a context of where we have been, where we might be going as far as a health care system. In the US, some people call it a sick care system, because it helps us understand why people's behaviors are what they are, why the system doesn't cooperate kind of like we would like it to. So, did you know, this is a little Trivial Pursuit, for those who are old enough to play Trivial Pursuit, did you know that healthcare, as far as health insurance goes, started in the private sector in the 1930s? And healthcare in the U.S., much like our founding fathers felt the U.S. should be developed and go forward in very much a spirit of entrepreneurship, the freedom to do what you would like to do and to make a life as you would like to make it, which is fantastic. We are, of course, very fortunate that we have that type of philosophy here in the United States. And so the insurance industry started in about the 1930s, somewhere in the 1930s, and the under the same philosophies as, there's a need, we're going to fill the need. Of course, health is an important commodity in all of our lives, and became very much recognized as so in the early 1900s. And so it made sense for some folks to start an insurance industry. So the private insurance industries really started in the 1930s. And it wasn't until the 1960s until the U.S. federal government got involved in what we would consider health insurance with Medicaid, Medicare. And so the private insurance sector was really running for a good 30 years and before the federal government got involved. And so now we have a balance between the two. What it has done is created a very complex system, to be sure. It's difficult for all of us to wrap our arms around what health care even is in the U.S. We know what health is, at least we think we do with our own personal health, but the healthcare system is very complex, and as it is developed, and it's got a lot of players, a lot of actors involved, and for, I guess, lack of a better word, actors. But so having so many actors involved or players involved has definitely increased the complexity of the healthcare system, and unfortunately has decreased the coordination of that. Because we have that type of complexity, the enormity of the amount of people involved with actually running the system, it has unfortunately developed into having a little coordination, and that's something that we are all trying to get our arms around now, is how to better coordinate care. Interesting part about life as we know it here in the U.S., and this is great, is one of the great things too, is that, but it can be a downside also, is that money talks. So, when you talk about health care, about 30% of our population in the U.S. Has coverage for their health care from the federal government side, Medicare, Medicaid. About 54% or so have private insurance. And some estimates are even a little bit greater than that. And the majority of the people in the private sector side have that through their employer. So what does that mean? That means that the majority of the people getting their insurance privately, it's really the private piece and that drives much of what we do for healthcare, and with little oversight, or not little, but a lesser amount of oversight from the federal government. And that's very much the philosophy of our country, is to have little oversight, maximum flexibility, little oversight from the government with maximum opportunity flexibility for us as citizens. And so knowing that, understanding that is important to understand how our healthcare system has progressed from the time where it really started. So thinking about health and health care, the system, think of it as that, has really only been around for less than 100 years. And in the magnitude of all of humankind, that is a very short blip on the map. And so we are, to be fair, just still on the front end of what a healthcare system should be, what it should look like, and how it should develop. And we're all working through that process, as we know. So that has developed into some things that are good and some things that are not good. Unfortunately, in the United States, 1 in 6 Americans currently does not have health insurance or is underinsured. This is actually before the Affordable Care Act, and this is one of the primary drivers for the Affordable Care Act, was to have all Americans have some form of health insurance. We know that uninsured, underinsured folks, there's a significant financial burden there, whether you're trying to pay for health care up front or trying to pay for the avoidance of health care on the backside when you have chronic diseases and such. And by some estimates, underinsured, uninsured folks having to deal with health care expenses has contributed to about 60% of the bankruptcies here in the U.S. So not only is it important for us as a nation that we care for each other as far as our health, but economically it's incredibly important as well. So when we cover social justice issues here in the U.S., obviously this is a big one that stands out. Another interesting fact about the way health is delivered and health care in the U.S. is nearly 1 in 4, almost a quarter of Americans are what we refer to as unofficial health care providers for a family member or a friend. So there's a huge portion of our society that's caring for others. This is fantastic that we care for each other in this way. But it's also difficult because they may be doing so because they don't have access to care, or doing so because it's something within the system doesn't allow for people who have been trained to do this, to care for the folks who need it. It also gives great opportunity to teach for us as healthcare providers in the health and wellness industries to train folks who are maybe not healthcare providers, but to give them some basic skills as they care for one another. So how do we, I know this is probably difficult to see on the slide behind me, but you have it in your slide deck that you can get in blue line. But the reason I wanted to put this up here is to show how we compare to the rest of the countries that look like us in the world. So out of the 11 wealthiest nations in the world, we can look on this chart and see, this is data that was published in 2013, but we can see how we rank as far as amount of money we spend and the important outcomes, at least on this list, the important outcomes for our health care. And as you can see from here, we're ranked number 11 overall. So we're last on the list of the wealthiest nations. And if you look all the way to the bottom on the right side, it shows how much we spend, and we spend a lot more than anybody else. So we have a great disparity there in the amount that we spend and what we actually get for that. And to be fair, we've got some great outcomes in some specific areas for healthcare. So by some accounts, we are great at what we're doing here in healthcare. But by and large, looking at population as a whole, we're not caring for each other the way we should be as far as outcome-wise compared to the amount of money that we're spending. Very interesting, again, very much of a social justice issue that is something for us to consider. So, complex system equals complex solutions. There's no easy answer for this. It's, when it's not like in some scenarios, like putting this course together, I could sit down and put the whole thing together from start to finish and have a plan and specific movements and expect specific outcomes because of the plan was all put together in a box. Well, the US healthcare system was not designed like that. It has evolved over time and has become more complex as it has evolved. So therefore you can't then just say, well, this is our one solution, because there really is no, the system is too complex for that. So the solutions are complex too, and we're working, I think, at them one at a time. So what does that mean for us? Well, that means we have great opportunities. So the Pollyanna person in me, or the opportunistic person, says, okay, we've got a complex system, takes complex solutions, that equals a lot of opportunity for all of us to make a difference. One of the interesting areas I think that we can make some great ground in this is in worksite wellness, and the paper that a couple of the readings that I have for you talk about this, but and in the Affordable Care Act, it actually was set up to, in some ways, to give incentives for employers to have their employees be more healthy. And this makes great sense because still, regardless of what the unemployment rate is in the United States, most Americans are working, and most Americans are getting their insurance through their worksite. And so when you talk about the money talks. Who cares about the money? Well, the employer really cares about the money because it affects their bottom line. If they have an unhealthy employee, then they're not as productive. And they're paying more in direct expenditures for healthcare, indirect because of productivity and that sort of thing. So we've got great potential to do some work in health and wellness at the work site, and we'll probably be talking about that more as we go through the course. But the paper that I gave to you in the Journal of Chronic Disease covers this very nicely and relates it back to the Affordable Care Act and part of the reason why the government wanted to put that piece in there. So that's my overview for the week and for the module on the U.S. healthcare system. Happy reading. I hope you find a lot of good information from there and have even more questions and more thoughtful reflections from reading this week's work. Thanks.